consultative process involves taking a series of photos and doing a complexion analysis. And so right now we have our patient in the photography box. We have a computer screen so that we can capture the photos. And we have her positioned for a photo on the left side of her face. Go ahead and take the picture. We always warn our patients that there's going to be 2 clicks, a flash, and then a grindy noise, so it just doesn't harm them in any way. Then we reposition the handpiece. So after the photography is done, we're given a report card, so to speak. So essentially what happens is the photos are analyzed in a database and compared to the database that matches her age and her skin type. And then we're given several factors to look at. So the first area that we're looking at right now is showing how many spots she has on her face. So where the camera and the screen picks up both brown spots and red spots, and so you can see she really doesn't have a lot of spots on her face. We don't want any spots on her face, but compared to 100 women in the room, her skin is better than 95 of them. That's how this photo is being interpreted. As we get older, we do lose collagen in all of our face, but in the nose the skin is thinner, temples the skin's thinner, so we tend to see more pores showing up in those areas as the collagen around it becomes less prevalent. The photo that scares most people is just how much sun damage we've had over the years, and she's must have kept her skin out of the sun because she really hasn't had a lot of UV damage. She has a little bit of these blotches, so several treatments with photofacials or with some chemical peels will clean that up, and then some skincare products that specifically address deep UV damage. And then typically these spots have got blood flow to them, so you can see the areas that had the spots also had a little bit of blood flow. So this picks up how much redness is in the face. She's got a little bit of broken blood vessels around the nose, not a lot, so a laser treatment would help with that. And then the last thing we look at is just how much skin bacteria, because when we see people with a lot of bacteria, and they have acne, that's a completely different skincare regimen than people who have no bacteria and acne. So a lot of acne sufferers will often say, everything dries me up, it just gives me more pimples. Well, they typically are the ones that have very little in the way of skin bacteria, and so you can't use aggressive products on them. So it's good to know how much bacteria is present on the skin. The other analysis we like to do is I like to show people what their skin age is. You can see that she's 32 years old, but her actual age, that her skin looks like a 22-year-old. And if you see her live, you would actually agree that she does look more like a 22-year-old than a 32-year-old. That's a fun thing, and a lot of people, as we age, we do lose the length and the thickness of our eyelashes. So what this is doing is it's measuring the length and the thickness of her eyelashes, and basically a grade 1 is nice, thick, lush eyelashes. Grade 2, she's getting a little bit of thinning, but it's a little bit thicker. She's got mascara on, so she's probably a grade 3, so we can make recommendations for improving the thickness of the eyelashes as well, just looking at this. And then we can come back, several months later to see how well are these products doing. The point I'm making is that we're looking at the skin now, and we're able to compare it to prior to treatment session and give us an idea of how well we did with our treatments. So that's really a good thing.